something so yes coding. Okay. So my voice is clear.
Yes, sir.
Yes, sir.
Okay. Because so I have no internet today because so in Hyderabad, so lot of people facing the same issue. So the cable connections are cut. So have some problem with internet. So
Yes, sir.
okay. Yeah. So coming to ICD-10 PCS, ICD means International Classification of Diseases. 10 means 10th revision. PCS means Procedure Coding System. Okay, so the PCS means Procedure Coding System. Okay, so these procedure codes are only used for inpatient admissions. Okay, so the patient is admitted to inpatient. So that time the provider performed any procedure during the inpatient hospital stay. So that time only we can assign this ICD-10 procedure codes. Okay, do not use this ICD-10 PCS codes for outpatient settings. Okay, so this ICD-10 PCS is completely used for inpatient coding only. Okay, sorry, I was recording. Yeah. See, the ICD means International Classification of Diseases. 10 means 10th revision. PCS means Procedure Coding System. This is consists of procedure codes. Okay. So all ICD-10 PCS codes have an alpha with numeric structures. Okay. So even that coming to diagnosis code. Okay. Yeah. Even coming to diagnosis, all ICD-10 diagnosis codes are alpha with numeric codes. Okay. Even the PCS. Okay. So the procedure codes also alpha with numeric codes. Okay. Yeah. Okay. So, but no decimal points and 7 characters. Okay. So all PCS codes are 7 character codes, but there is no decimal point. Okay. Decimal point means, for example, in ICD-10 so the asthma code, okay, after 3-digit J45 point, okay, 909 is the asthma code, right? So that time after 3 digits, we will give one decimal. Okay, decimal means that is dot. Okay, point. Okay, but coming to ICD-10 PCS, so there is no decimal point in ICD-10 PCS. Yeah. So there is no decimal point in ICD-10 PCS. All PCS codes are 7 characters. Okay. So the ICD-10 PCS is divided into 17 sections relating to the general type of procedures. Okay. So totally how many sections in ICD-10 PCS means total 17 sections in ICD-10 PCS. Okay, so the ICD-10 PCS is divided into alphabetic index, tabular list, and list of codes. Okay, so even the ICD-10 also divided into 2 volumes. Okay, volume 1 and volume 2. What is volume 1 and what is volume 2 in ICD-10? Tell me, anyone. So what is volume 1 and what is volume 2 in ICD-10? So many coders, you have a lot of experience, right?
Alphabetical tablets.
What is alphabetic index?
Volume 1 is alphabetic index and
Okay.
volume 2 is tabular list.
Volume one is tabular list, volume 2 is alphabetic index. Okay, volume 1 is tabular list and volume 2 is alphabetic index. Even the PCS also same. Okay, so this is just information. Okay, who are first implementation for ICD-10 PCS. Okay, so generally the ICD-10 PCS coding is updated annually. Okay, by 3M HIS. Okay, so the 3M HIS is developed for ICD-10 PCS coding. Okay, HIS means Health Information System. Okay, HIS means Health Information System. Okay. So the basic variation between ICD-9 CM versus ICD-10 CM because in the procedure coding. Okay. So previously before ICD-10 CM, we are using ICD-9 CM. Okay. In ICD-9 CM, so the procedure code like see the laparoscopic appendectomy, the procedure code is only 47.01. Okay. So that is all are numerics. Okay. After 2 characters, 1 decimal point is there. Okay, but in ICD-10 CM, okay, so the PCS, ICD-10 PCS, so now the laparoscopic appendectomy code is 0DTJ4ZZ. Okay, so this is the variation between ICD-9 CM versus ICD-10 CM. So this is not necessary for you. Okay, so this is also is not necessary. Yeah. Yeah. Coming to ICD-10 PCS code structure. So this is very important interview pattern question. Okay. So what is the ICD-10 PCS code structure? Okay. So coming to ICD-10 PCS. Okay. So total 7 characters in ICD-10 PCS. So the first character is section. So the second character is body system. The third character is root operation. The fourth character is body part. The fifth character is approach. The sixth character is device. And the seventh character is qualifier. Okay. So the sequencing also very important. Okay. Based on these 7 characters, we will assign all procedure codes. Okay. All appropriate procedure codes we will assign based on these 7 character values. Okay, so explain about the ICD-10 PCS code structure. So this is the intro pattern question. So that time all PCS codes are 7 characters. So the first character is section. Yeah, so the first character is section. So the second character is body system. So the third character is root operation. So the fourth character is body part. The fifth character is approach. The sixth character is device. And the seventh character value is qualifier. Okay, so we will discuss one by one. Okay, one by one characters. Okay. Yeah, so the first character section. Okay, so the first character section, total 17 sections in PCS coding. These are all the 17 sections with possible character values. Okay, so the med and surgical section, the character value is 0. Okay, so the 1 is obstetric section, 2 is placement, 3 is administration, 4 is measurement and monitoring section, 5 is imaging section, 6 is nuclear medicine, 7 is radiation oncology, 8 is osteopathic, 9 is rehabilitation and diagnostic cardiology. Okay. Just listen, guys. Okay, once the class is completed, so I will share this PPT and class recording also. Okay, so don't worry. So just listen the class. Okay, so the total how many sections in PCS coding means total 17 sections in PCS coding. So the first character is 0, med and surgical section. So the character value is 0. The second character 1, so that is obstetric. The next character 2, that is placement section. 3 is administration section. So 3 is administration, 4 is measurement and monitoring, 5 is imaging section, 6 is nuclear medicine, 7 is radiation oncology, 8 is osteopathic, 9 is rehabilitation and diagnostic audiology. So B is extracorporeal assistance and performance, C is extracorporeal therapies, D is laboratory, F is mental health, G is chiropractic, H is miscellaneous, and X is new technology. Okay, so the character X is new technology. Okay, so basically the zero med and surgical section is the major important section. So the very big section in ICD-10 PCS. Okay, so the next 2 to 3 weeks, we are given any procedure code, the first character starting with zero only. Okay, most of the intro pattern questions, so they are asking this section only. Okay, med and surgical section. Okay, so this is the very important section. After minimum 2 to 3 weeks, this section is. Okay, after that the remaining sections only completed one class only. Okay, the remaining all sections completed within 1 hour, but the med and surgical section is so largest section in PCS coding. So we will learn at least 2 to 3 weeks for this section. Okay, maximum 3 weeks. Okay, so just so in intro pattern, they are asking how many sections in PCS coding. Give me some examples. Okay, so that time you can remember at least zero med and surgical section. So the character value is not necessary, just med and surgical section, obstetrics section, placement, administration, measurement and monitoring, imaging, pathology, nuclear medicine, laboratory, chiropractic, something. Okay, you can give at least 4 to 5 sections examples. Okay, understand?
Yes, sir.
Yes, sir.
Instruments. Okay, so that is section. Okay, so the next one, second character is body system. Okay, so these are all the body systems and possible character values. Okay, you did not remember the character values, that is not necessary. Okay, so the body systems like central nervous system, peripheral nervous system, heart and great vessels, upper arteries, lower arteries, upper veins, lower veins, lymphatic and hemic, including lymph vessel and lymph nodes, eye, ear, nose, sinus. Yeah. Okay. So ear, nose, sinus, respiratory system, mouth and throat, gastrointestinal system, hepatobiliary and pancreatic system, endocrine system, skin and breast, including skin and breast glands, ducts, and subcutaneous tissue and fascia, muscle, tendons, bursa and ligaments, head and facial bones, lower bones, upper joints, lower joints, urinary system, female reproductive system, male reproductive system. Yeah, sorry. Female reproductive system, male reproductive system, and anatomical region general, anatomical region upper extremity, anatomical region lower extremity. Okay, so these are all the body systems, guys. Okay, so these are all body systems. For example, now the patient admitted for kidney stones, so the physician removed kidney stones. Okay, so that time, that is section, the first character section, that is med and surgical section. So the character value is 0. The second one, body system. So the kidney is which body system?
Urinary tract.
Yes, urinary tract. Okay, so the kidney is under urinary tract. So that time the second character value is T. Okay, for example, total abdominal hysterectomy. Okay, so what is mean by hysterectomy?
Removal of uterus.
Removal of uterus. Okay, removal of uterus. Okay, so that time what is the body system?
Genital.
Female reproductive system. Okay, female reproductive system. What is the character value for this female reproductive system?
You can.
U, right? So I will show you. Okay, so I will show you like. Okay. like we have the body systems like musculoskeletal system and circulatory system, right? So manaki body systems lo musculoskeletal and circulatory system untaya undava? Untai. Kani ikkada unnaya manaki? In this body system, musculoskeletal system and circulatory system is there?
No, sir.
Not
No,
there.
sir.
Okay, not there. So the musculoskeletal system, they are divided into like upper bones, lower bones, upper joints, lower joints. What is that? Tendons, ligaments. Okay, tendons, ligaments, bursa, like this. Okay, so the musculoskeletal system is divided into so many systems in body systems in ICD-10 PCS. Even the circulatory system like upper arteries, lower arteries, upper veins, lower veins, like. Okay, so when to assign anatomical region general, the W character. Okay, W is anatomical region general. Okay, when to assign this general body part, body system means the procedure is performed in body cavity area. Okay, like peritoneal cavity, pleural cavity, retroperitoneal cavity, pelvic cavity. Okay, so the procedure is performed in any body cavity area. So that time we can assign so the character value W. Okay, anatomical region in general. For example, now the patient admitted to the hospital for ascites. So the physician performed paracentesis procedure. Okay, what is mean by paracentesis?
Removal of
Non-ac-
excess fluid from cavities.
Yes, removal of ascitic fluid from the peritoneal cavity. Okay, so the paracentesis procedure means removal of fluid from the ascitic fluid. Which fluid means ascitic fluid? Removal of ascitic fluid from the peritoneal cavity. Okay, so that time the first character 0, med and surgical section. The second character is cavity. Cavity area means so that time what is the body system?
W.
W, sir.
W. Yes, good. Okay, see. Paracentesis, for example. Okay. So paracentesis. Okay. So paracentesis, peritoneal cavity. See 0W 9G. Okay. So the W is anatomical region general, right? Okay. So this is body system. Okay. So next one. So this is body system like circulatory system, nerve system, respiratory system, digestive system, skeletal system, muscle system like. Okay, so mark X next to each terms to phrase identify a body system as classified by unique value with ICD-10 PCS. Okay, so manki ICD-10 PCS ఏమేమి ఉన్నాయి ఇక్కడ body systems అంటే yes, respiratory system is there. So that time you can assign X. Heart and great wedges, the body system is there. You can assign X. But circulatory system not there, you can give blank. Musculoskeletal also not there, you can give blank. Upper bones, so the body system is there. Okay, so 1 2 5 is the correct answer, so 3 and 4 is blank. Okay, yes, see. So next one, the root operation, the third character value. Okay, so this is the very important role in PCS coding. Okay, so in ICD-10 CM, we can identify main term, subterm, carry over line, right, at the time of code leading. Okay, in procedure coding, so the main term is the root operation. Okay, so the main term is root operation. First, you can identify the root operation in the operative report. Okay, so in the specific procedure. Okay, so overall, how many root operations in ICD-10 PCS means 31 root operations. Okay, so each and every root operations, I will give at least 5 to 10 examples. Okay, I will tell you what is root operation, and so what is the important role in root operation for ICD-10 PCS. Okay, so we will learn daily basis at least 2 to 3 root operations. Sometimes we will learn 5 root operations on single day also. Okay, I will tell you what is alteration, what is bypass, what is change, what is control, what is creation, and some examples like. Okay, so alteration, so bypass, change, control, creation, destruction, detachment, dilation, division, drainage, excision, extirpation, extraction, fragmentation, fusion, insertion, inspection, mapping, occlusion, reattachment, release, removal, repair, replacement, reposition, resection, restriction, revision, supplement, transfer, and transplantation. Okay, so these are overall 31 root operations in ICD-10 pieces, guys. Okay, so these are all the definitions for what is alteration, what is bypass. Okay, we will discuss these definitions one by one. Okay, so one by one, so in next classes. Okay, so this is PCS code structure. The first character is section. Coming to section, how many sections in PCS means total 17 sections. Give me some examples for 17 sections. So like med and surgical section, obstetric section, administration section, measurement and monitoring section, chiropractic, laboratory. Okay, so extracorporeal assistance and performance. Okay, so these are all the examples. Okay, new technology for X. Okay, so these are all the sections. Okay, examples. Okay, these are all the examples for section. So the second one, the body systems. Okay, so in body system, the mainly anatomical region general, we when considered anatomical region general means, so when the physician performed the procedure in body cavity area, so that time we can consider anatomical region. So W. Okay, so after W, X and some Y. Okay, X and Y character. So anatomical region upper extremity and anatomical region lower extremity. Okay, when we considered anatomical region upper extremity and anatomical region lower extremity body part means, so the physician removed entire body part, like, so for example below knee amputation, okay, or above knee amputation, okay, or leg amputation, or toe amputation, or hand amputation. అంటే ఆ టైంలో హ్యాండ్ మొత్తాన్ని తీసేయడం, టో మొత్తాన్ని తీసేయడం, లేదంటే ఫుట్. ఓకే, సో దే రిసెక్టెడ్ ఎంటైర్ ఫుట్. Okay, so that time, so they removed the skin, subcutaneous tissue, muscle, fascia, bone, tendon, ligament, arteries, nerves, veins, everything. Okay, everything they remove. Okay, so not only for joint, not only for bone, not only for skin, not only for subcutaneous tissue. Okay, so that time the physician removed entire, okay, everything. So that time only we can assign anatomical region upper extremity and anatomical region lower extremity. So these body systems are only used for amputation procedures. Okay, we will learn on next classes. So what is amputation? So how to code for amputation procedures like. Okay, so next, how many root operations in PCS coding means 31 root operations. So give me some examples: alteration, excision, bypass, resection, transplant, transfer. Okay, so reattachment, drainage, insertion. Okay, so removal, replacement, reattachment. Okay, drainage. So these are all the extirpation, fragmentation. Okay, so these are all the examples for root operations. Okay, so these are all the common basic interview pattern questions, guys. Okay, and what is the PCS code structure? Okay, so total 7 characters. The first character is section. So the second character is body system. So the third character is root operation. So the fourth character is body part. So the fifth character is device, sorry, approach. The sixth character is device, and the seventh character value is qualifier. Okay, so these are all the basic interview pattern question for ICD-10 PCS. Okay, so the basics are bore. Okay, I can understand. Okay, once the code structure, the 7 character values are completed, so after that we will start root operation. So that time definitely, so the PCS coding is very, very interesting. Okay, so these 31 root operations are divided into 9 groups, guys. Okay, so we will discuss one by one these groups. Okay, in coming slides. Okay, so these are all 9 groups. Okay, so they are asking like how many groups divided into 31 root operations. Okay, so 9 groups. Take out some are all of your body part. So take out solids, fluids, or gases from the body part involving cutting or separation only. What is mean by taking solid fluids or gases from the body part? So we will learn this very detailed in the coming slides, guys. Okay, so these are all just basics. Okay, just you can learn. Okay, for example, in respiratory system, one procedure is performed. Okay, so that time, what is the body part? Okay, so the body part. Okay, so what are the respiratory organs? Okay, like larynx, pharynx. Okay, so lungs, bronchus, trachea. Okay, so these are all the respiratory parts, right? Okay, trachea, upper lobe, lung, right lower lobe, left lower lobe, something. Okay, so these are bronchus. Okay, so these are all the lung parts. Okay, these are all respiratory parts. Okay, for example, now the patient comes for right lower lobe lung cancer. So the physician performed right lung lower lobectomy. Okay, so the physician removed entire lobe because of this cancer. Okay, so that time we can give right lower lobe lobectomy, one specific procedure code. Okay, for example, see, I will show you so how to lead the code. Okay, so lobectomy, lobectomy. Okay, so lobectomy, C, excision respiratory system, C, resection respiratory system. When we consider excision, when we consider resection, so we will learn these are very detailed in the coming slides. Okay, for example, 0BT. Okay, so the 0 is the med and surgical section, B is the respiratory system. Okay, so that is body system. The root operation is resection, the body part. Okay, for example, right lower lobe lung. Okay, where is the body part for right lower lobe lung? Right lower lobe lung. What is the character value? Lower lung lobe right, where it is?
F.
F,
sir.
F, sir.
F, sir.
Okay, so the character
F for
value
lung.
is F. Okay,
F.
so the character value is F. Okay, so next approach like open approach, no device and no qualifier. So the overall code is 0BT F0ZZ. Okay, so the complete code is 0BT F0ZZ. మీరు ఏమి కోడ్స్ అయితే గుర్తుపెట్టుకోవాల్సిన అవసరం లేదు. Okay, don't remember any single PCS code. Okay. So this is like body part. For example, in digestive system, some biopsy is performed. Okay, so that time, what is the site? Okay, what is the site? Site means that is the body part. Okay, that is like duodenum or stomach or esophagus or sigmoid colon or ascending colon or descending colon or anus or rectum. So what is the exact body part? Okay, so that time only, so we will learn basics of anatomy, guys. Okay, you can understand at least some anatomy. Okay, so when PCS codes are assigned, so that time the anatomy also one of the important role in PCS coding. Okay, so this is body part. Okay, so next, so this is not necessary. Next. Okay, approach. So the fifth character value is approach. So this is very, very, very important question in interview pattern. Okay, so definitely 90% is okay. 90% of interviewer definitely asking this question. Okay, so total how many approaches in PCS coding means 7 approaches. Okay, approach means the reached the site. Okay, so ఆ ప్రొసీజర్ చేయడానికి ఆ సైట్ ని రీచ్ అవ్వడానికి ఏ అప్రోచ్ ఫాలో అవుతున్నాడు, లైక్ సో ద అప్రోచెస్ లైక్ open approach. Okay, so I will tell you what is open approach. Okay, so percutaneous approach, percutaneous endoscopic approach, via natural or artificial opening, via natural or artificial opening endoscopy, via natural or artificial opening with percutaneous endoscopy, and external approach. Okay, so these are 7 approaches in PCS coding. So these are the very important approaches and very important interview pattern question also. Okay, how many approaches in PCS coding and what are the approaches? Okay, so total 7 approaches in PCS coding: open approach, percutaneous approach, percutaneous endoscopic approach, via natural or artificial opening, via natural or artificial opening endoscopy, via natural or artificial opening with percutaneous endoscopy, and external approach. Okay, first, through the skin. Okay, any procedure through incision through skin. So that time there are 3 approaches. One is open approach, percutaneous approach, and percutaneous endoscopic approach through the orifice. Okay, through the orifice means like mouth, rectum, anus, like so. These are all the orifices. Okay, urethra, bladder, some. So these are all orifices. So 1 second. Yeah. So the first one, open approach. Okay, open approach means cutting through the skin or mucous membrane and any other body layers necessary to expose the site of the procedure. Okay, so anti a site low. Okay, for example, the physician performed some surgery, okay, for kidney or heart or some other body part, okay, or gallbladder or liver. So that time the physician initially cutting through the skin or mucous membrane. Okay, అంటే ఆ బాడీ పార్ట్ దగ్గర ఉండే స్కిన్ కానీ మ్యూకస్ మెంబ్రెయిన్ కానీ ఆర్ ఎనీ అదర్ బాడీ లేయర్స్. ఓకే, లైక్ సబ్క్యూటానస్ టిష్యూ, మజిల్, ఫేషియా. Okay, so these body layers, okay, necessary to expose the site of procedure. Okay, అంటే ఆ సైట్ ని రీచ్ అవ్వాలి అంటే so before that, so the physician remove so these layers. Okay, so after that only, so the physician reached the site and they perform the surgery. Okay, so that type of approach is considered as open approach, like open CABC. Okay, so coronary artery bypass graft. Okay, so this is one of the open heart surgery. So this is very major surgery. Okay, so in coming slide, when we learn bypass route operation, so that time I will tell you so how to code for CABC procedure. Okay, coronary artery bypass graft and abdominal hysterectomy. Just now we are seeing that code, right? So how to lead abdominal hysterectomy, like open approach. Okay, so these are the examples for open approach. Okay, so when open approach means cutting through the skin or mucous membrane. Okay, ఆ స్కిన్ గాని mucous membrane గాని కట్ చేసి excised, okay, excision చేస్తారన్నమాట. excision చేసి so they reached the anatomical site. Okay, so ఏ సైట్ లో అయితే మనకి సర్జరీ పర్ఫామ్ చేయాలనుకుంటున్నాడో so the physician reached that site. Okay, and they performed the surgery. So that type of approach is called as open approach. So that time the incision is mandatory. Okay, the cutting, okay, the excision is mandatory for open procedures. Okay, next, percutaneous approach means entry by puncture or minor incision. Okay, so very small incision. Okay, so of instrumentation through the skin or mucous membrane. Okay, and any other body layers necessary to reach the site of the procedure. Okay, like మనకి ఇప్పుడు నీడిల్ బయాప్సీ. ఓకే, నీడిల్ అంటే ఆ ఇన్సిషన్ ఏమవుతుంది, అది మేజర్ ఇన్సిషన్ అయితే మనకు ఓపెన్ అప్రోచ్ అవుతుంది. వెరీ మైనర్ ఇన్సిషన్ ఉంటే సో దట్ టైప్ ఆఫ్ అప్రోచ్ ఈస్ కన్సిడర్డ్ యాజ్ percutaneous approach, like liposuction. Okay, at the time of liposuction, so the physician performed some tube. Okay, the tube is inserted into the fat pocket. Okay, ఎక్కడైతే మనకి ఇప్పుడు ఆ ఫ్యాట్ అనేది ఎక్కువ ఉంటుందో ఫిజిషియన్ అక్కడ మనకి ఒక ట్యూబ్ అనేది ఇన్సర్ట్ చేస్తాడు. ఓకే, ద ట్యూబ్, ఓకే, సక్షన్ ఇంటూ ద ఫ్యాట్. ఓకే, సో ఆ ట్యూబ్ కి చివర మనకి షార్ప్ ఆబ్జెక్ట్ ఒక రంపల్లా ఉంటుంది అనమాట. సో ఆ బ్లేడ్స్ అనేవి ఆ కొవ్వును కట్ చేసి సో సక్షన్, ఓకే, మనకి వాక్యూమ్ ఎలా పంప్ చేస్తుందో ఆ ట్యూబ్ లో నుంచి పంప్ చేసి బయటికి తీస్తారు అనమాట. ఓకే, సో అంటే ఇప్పుడు అక్కడ ఇన్సెషన్ దేనికోసం చేసినట్టు అంటే సో దే ఇన్సర్ట్ ద ట్యూబ్. ఓకే, అంటే ఆ ట్యూబ్ ఇన్సర్ట్ చేయడం కోసం, ఆ నీడిల్ పాస్ చేయడం కోసం, ఆ కెథటర్ పాస్ చేయడం కోసం మనకి ఇన్సర్ట్ చేశారు అంటే సో దట్ టైప్ ఆఫ్ అప్రోచ్ ఈస్ కన్సిడర్డ్ యాజ్ percutaneous approach. Okay, understand guys what is the difference between open versus percutaneous approach?
Yes, sir.
మీకు ఏమైనా డౌట్స్ ఉంటే ఇమీడియట్ గా అడగండి. సో నేను ఇమీడియట్ గా మీకు క్లారిఫై చేస్తాను. There is no issue with open and percutaneous approach, right?
Yes, sir.
Sometimes some guidance like some fluoroscopy imaging, for example, ఇప్పుడు liver లో biopsy చేయాలనుకుంటున్నాడు. సో ఇప్పుడు ఆ నీడిల్ ఎగ్జాక్ట్ గా liver కి వెళ్ళిందా లేదా వాడికి ఎలా తెలుస్తుంది? So that time the physician using some fluoroscopic guidance, some CT guidance, some ultrasound guidance. Okay, when the physician using these guidance, okay, so that time we can consider the type of approach is considered as percutaneous approach. ఓకే, ఇప్పుడు లంగ్ లో బాప్సీ ఫైన్ నీడిల్ ఆస్పిరేషన్ ఆఫ్ లంగ్ అని చెప్తున్నాడు. ఓకే, ఇప్పుడు ఆ ఫైన్ నీడిల్ ఆస్పిరేషన్ ఆఫ్ లంగ్ అంటే ఇప్పుడు ఆ లంగ్ లోకి ఆ నీడిల్ వెళ్ళిందా లేదా ఫిజిషియన్ కి ఎలా తెలుస్తుంది? అటు ఓపెన్ చేయట్లేదు కదా, పెర్క్యూటానియస్ అప్రోచ్ కాబట్టి. సో డెఫినెట్లీ దే ఆర్ యూజింగ్ సమ్ రేడియోలాజికల్ ఎక్విప్మెంట్ లైక్ ఫ్లోరోస్కోపీ ఆర్ ఎంఆర్ఐ ఆర్ సిటీ ఆర్ అల్ట్రాసౌండ్ సంథింగ్. ఓకే, సో ఎందుకు అంటే ఆ నీడిల్ ఎగ్జాక్ట్ గా ఆ లొకేషన్ కి వెళ్ళిందా లేదా తెలుసుకోవడానికి. సో దే ఆర్ యూజింగ్ సమ్ గైడెన్స్ అన్నమాట. Okay, so any guidance is using for the surgery, so that time the surgery approach is considered as percutaneous approach. That is also one of the clue. Okay, some catheters like PICC line catheter, central venous catheter. Okay, any artery or vein. Okay, ఎప్పుడైనా ఏదైనా ప్రొసీజర్ ఏదైనా ఆర్టరీ నుంచి కానీ వెయిన్ నుంచి కానీ ప్రొసీజర్ అనేది పర్ఫామ్ చేస్తే, సో దట్ టైప్ ఆఫ్ అప్రోచ్ బై డిఫాల్ట్ కన్సిడర్డ్ as percutaneous approach. ఓకే, అండర్స్టాండ్ గైస్? ఎందుకంటే ఈ ఆర్టరీని వెయిన్ ని కట్ చేసి ఓపెన్ చేస్తే మనకి ఇప్పుడు ఆ బ్లడ్ అనేది సో ఎంత ఫ్లో అవుతుందో మనకి తెలుసు. ఓకే, చాలా బ్లడ్ లాస్ అయిపోతుంది, చాలా ప్రాబ్లం అవుతుంది. దట్ ఈస్ కాంప్లికేషన్ ఫర్ సర్జరీ. ఓకే, సో దట్స్ ద రీజన్ దట్ టైమ్ దే ఇన్సర్టెడ్ సమ్ catheter ఆర్ ట్యూబ్ ఆర్ సమ్ needle is inserted into that artery or vein. Okay, so that type of approach is considered as percutaneous approach. Clear? Percutaneous approach అర్థమైందా?
Yes, sir.
Next, percutaneous endoscopic approach. Okay, so the percutaneous endoscopic approach means the physician using any arthroscopy or laparoscopy. Okay, సో ఎప్పుడైనా ఏదైనా ఆర్థ్రోస్కోపీ యూజ్ చేసి లాప్రోస్కోపీ యూజ్ చేసి మనకి ఏదైనా ప్రొసీజర్ పర్ఫామ్ చేశాడు అంటే, ఓకే, సో ఎట్ ద టైమ్ ఆఫ్ ప్రొసీజర్, సో ద ఫిజిషియన్ యూజింగ్ some arthroscopy. When the physician using this arthroscopy means, so the procedure is performed under joint level. Okay, arthro means joint. Okay, so joint level lo evana procedures chesetappudu like arthroscopic knee meniscectomy. Okay, arthroscopic shoulder capsulorrhaphy or arthroscopic shoulder rotator cuff repair, like these procedures. Okay, so the type of procedures performed with the help of arthroscopy, so that time we can consider the approach is so percutaneous endoscopic approach. That time the fifth character value is 4. Okay, for example, laparoscopic appendectomy. Okay, laparoscopic appendectomy. So this is surgical section, right? The appendectomy is the surgery. Agree or not agree? Appendectomy surgery na kada?
Sir, removal of
Yes, sir.
Surgery.
Yes, sir.
Okay, removal of appendix
Removal of
means that is surgery. So the character value,
Surgery.
the first character section, what is the section? Med and surgical section, what is the character value?
0.
Zero. Okay, so the first character value is 0, med and surgical section. So the second character, the body system. Okay, so the body system, appendix, what is the body system for appendix? Digestive system. Good.
Digestive system.
Okay, appendix is the digestive system. So that time you can see what is the character value for digestive system. Yeah, see. So this is okay. So gastrointestinal system or digestive system, both are same. So what is the character value for gastrointestinal system?
D, sir.
D, sir.
Okay, D. Okay, D. 0 med and surgical section. The second character value is D. The third character, appendix, removal of appendix. So that time we can consider so the resection. Okay, and the entire appendix మొత్తాన్ని తీసేస్తాడు కాబట్టి the root operation resection. What is the character value for resection?
Dissection T, sir. T.
T. Okay,
T, sir.
so 0 dt. Okay, 0 dt is the correct code, right? 0 dt. Okay, C. Appendectomy, we will try. So appendectomy procedure code with laparoscopy. Okay, appendectomy with laparoscopy. Okay. So appendectomy. Okay. So resection of appendix, 0 DTJ. Okay. So 0 med and surgical section. So the body system D, gastrointestinal system. Root operation T, resection. మనకు అవే వచ్చాయి కదా, నేను ఇందాక కూడా మీకు అవే చెప్పాను, right? 0 DT. Okay. So the next, the body part is appendix. So the character value is J. Okay. Next, the approach, laparoscopy. Laparoscopic means that approach is considered as open approach or percutaneous endoscopic approach.
Percutaneous endoscopy.
Yes. Okay. Percutaneous endoscopic approach. Next, no device and no qualifier. Okay. No device and no qualifier. So see, the code is 0 DT J4ZZ. Okay. Resection of appendix. Okay. Percutaneous endoscopic approach. Okay. So this is the percutaneous endoscopic approach when the physician inserted any scope. Okay. So at the time of surgery, like, so the scope is percutaneously inserted. Okay. I will show you how to insert the scope. Okay. See. Okay. So this is what is the scope? What is the scope? ఈ స్కోప్ ఎక్కడ ఇన్సర్ట్ చేస్తున్నాడు చూడండి. అక్కడ ఇమేజ్ ఏం కనిపిస్తుంది మీకు?
లంగ్స్.
Lungs.
ఓకే, లంగ్ కనిపిస్తుంది. ఓకే, సో ఇప్పుడు లంగ్ దగ్గర ఒక స్కోప్ అనేది ఇన్సర్ట్ చేస్తున్నాడు లోపలికి. సో వాట్ ఈస్ దట్ స్కోప్? Thoracoscopy. So thoracoscopy. Okay, so the thoracoscopy is percutaneous endoscopic approach. ఎందుకంటే ఈ స్కోప్ అనేది ఇన్సర్ట్ చేయడం కోసం మనకు అక్కడ ఒక ఇన్సెషన్ అనేది చేస్తున్నాడు, రైట్? అలా డ్రిల్ చేస్తున్నాడు చూడండి, డ్రిల్ చేసి ఇన్సర్ట్ చేసి దాని ద్వారా స్కోప్ పాస్ చేస్తున్నాడు లోపలికి. సో దిస్ అప్రోచ్ ఈస్ కాల్డ్ యాజ్ విచ్ అప్రోచ్? దట్ ఈస్ percutaneous approach or percutaneous endoscopic approach?
Percutaneous
Percutaneous
endoscopy.
approach.
Yes. Okay, the scope is inserted through incision. Okay, so that scope is considered as percutaneous endoscopic approach. Okay, the approach is considered as percutaneous endoscopic approach. Okay, so the next approach is via natural or artificial opening. Okay, so via natural or artificial opening. So entry of instrumentation through a natural or artificial external opening to reach the site of the procedure. Okay, like Foley catheter placement. Okay, Foley catheter ఎక్కడ ఇన్సర్ట్ చేస్తారు? మనకి బ్లాడర్ లో ఇన్సర్ట్ చేస్తారు. ఓకే, సో అయితే డైరెక్ట్ గా బ్లాడర్ లోకి ఇన్సర్ట్ చేస్తారా? మేల్ లో అయితే సో పెనిస్, ఓకే, మనకి యూరిన్ బయటకి ఎలా వస్తుందో ఆ హోల్ లో నుంచి మనకి ఫోలీ catheter అనేది ఇన్సర్ట్ చేస్తారు. సో దట్ ఈస్ వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్. ఓకే, అంటే మనకి నేచురల్ గా అది ఓపెన్ అయి ఉంటుంది, లేదంటే దాన్ని ఇలా catheter ఆర్ నీడిల్ పాస్ చేసి సో దాన్ని ఆర్టిఫిషియల్ గా ఓపెన్ చేస్తారు అన్నమాట. ఓకే, సో దే ఓపెన్ ఆర్టిఫిషియల్. ఓకే, సో అలా మనకి ఆర్టిఫిషియల్ గా ఓపెన్ చేసినా లేదంటే వయా నేచురల్. ఓకే, అంటే ఇప్పుడు మనకి డిజిటల్ రెక్టల్ ఎగ్జామ్ ఉంది. ఓకే, సో ఇప్పుడు రెక్టమ్ లో ఏం ప్రాబ్లమ్స్ ఉన్నాయో ఐడెంటిఫై చేయాలి అనుకుంటే సో దే ఓపెన్ ద రెక్టమ్ డైరెక్ట్లీ. ఓకే, రెక్టమ్ ఎందుకంటే ఎక్స్టర్నల్ పార్ట్ కదా, మనకి బయటే ఉంటుంది, మనకి లోపల ఏమి ఉండవు ఇవి. ఓకే, సో దట్ టైప్ ఆఫ్ అప్రోచ్ ఈస్ కాల్డ్ యాజ్ వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్. ఓకే, అయితే ఇలా వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ లో ఏదైనా ఎండోస్కోపీ పాస్ చేశాడు అనుకోండి. ఓకే, సో దట్ టైప్ ఆఫ్ అప్రోచ్ ఈస్ కాల్డ్ యాజ్ వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ ఎండోస్కోపీ, లైక్ colonoscopy, EGD, esophagogastroduodenoscopy, cystoscopy, bronchoscopy, okay, sigmoidoscopy, rectoscopy, anoscopy. Okay, so these are all ERC, EGD. What is full form of EGD? Esophagogastroduodenoscopy. Okay, so the EGD full form is esophagogastroduodenoscopy. Okay, yes, EGD. Okay, esophagogastroduodenoscopy. ERCP. What is the full form of ERCP? Endoscopic retrograde cholangiopancreatography. Okay, so the ERCP full form is endoscopic retrograde cholangiopancreatography. Okay, so these type of procedures, okay, for example EGD, esophagogastroduodenoscopy, అంటే ఏం చేస్తాడు చూడండి, మనకి నోట్ లో నుంచి మనకి స్కోప్ అనేది పాస్ చేస్తాడు, లైక్ స్టమక్, డియోడినం, ఈసోఫాగస్ లో ఏ ప్రాబ్లమ్స్ ఉన్నాయో తెలుసుకోవడానికి, రైట్? ఈజీడీ మీన్స్ ఈసోఫాగోగ్యాస్ట్రోడియోడినోస్కోపీ. ఈసోఫాగస్, గ్యాస్ట్రో మీన్స్ స్టమక్, అండ్ డియోడినం, ఈ మూడిట్లో ఏ ప్రాబ్లమ్స్ ఉన్నాయో తెలుసుకోవడానికి మనకి సో మౌత్ ద్వారా మనకి స్కోప్ పాస్ చేస్తే, సో దట్ ఈస్ వయా నేచురల్. మౌత్ అనేది మనకి నేచురల్ గా మనం ఓపెన్ చేసుకుంటాం, ఓకే? వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ విత్ ఎండోస్కోపీ. దాని లోపల నుంచి మనకు ఒక స్కోప్ పాస్ చేస్తున్నారు అంటే సో దట్ ఈస్ వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ ఎండోస్కోపీ. లైక్ ఇప్పుడు మనకి కొలనోస్కోపీ ఉంది మనకి, ఓకే? కింద నుంచి మనకి రెక్టమ్ నుంచి పాస్ చేస్తారు స్కోప్, ఓకే? రెక్టమ్, యానస్, సో దాని తర్వాత మనకి కోలాన్, ఓకే? సో ఆ కోలాన్ లో మనకి స్మాల్ ఇంటెస్టైన్, లార్జ్ ఇంటెస్టైన్, రైట్ కోలాన్, లెఫ్ట్ కోలాన్, సో అసెండింగ్ కోలాన్, డిసెండింగ్ కోలాన్, ట్రాన్స్వర్స్ కోలాన్, సిగ్మాయిడ్ కోలాన్, చాలా ఉంటాయి. ఓకే, సో ఏ కోలాన్ లో ఏ ప్రాబ్లమ్స్ ఉన్నాయి అనేది ఐడెంటిఫై చేయడానికి లైక్ సిగ్మాడోస్కోపీ అనేది యూజ్ చేస్తుంటారు, లైక్ కొలనోస్కోపీ, నాట్ సిగ్మాడోస్కోపీ. సో దట్ టైప్ ఆఫ్ స్కోప్ is approach considered as via natural or artificial opening endoscopy. I will show you one image. Yeah, this one. What is the approach? So చూడండి, మనకి మౌత్ ద్వారా ఒక స్కోప్ అనేది లోపల పాస్ చేసి అక్కడ ఆ ఎండోస్కోప్ ద్వారా ఈ డియోడినం, స్టమక్ వాటిని రివ్యూ చేస్తున్నాడు, ఓకే? లైక్ దిస్ ఈజ్ ఈజీడీ. వాట్ ఈస్ ద అప్రోచ్?
Natural, sir.
Natural or artificial opening?
Natural.
Via natural or artificial opening?
Natural.
ఎండోస్కోపీ. ఇక్కడ చెప్తున్నాడు కదా ఎండోస్కోపీ పాస్ చేశానని చెప్పి, ఓకే? సో వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ ఎండోస్కోపిక్ అప్రోచ్, ఓకే? సో అంటే మనకి ఇప్పుడు నేర్చుకునేటప్పుడు ఇలా నేర్చుకుంటున్నాం. ఫర్దర్ గా మనకి ఇప్పుడు ఫర్ ఎగ్జాంపుల్ ఈజీడీ యూజ్ చేసి మనకి స్టమక్ లో బాప్సీ చేశాడు ఫర్ ఎగ్జాంపుల్, ఓకే? సో దట్ టైమ్ గో టు యాడ్ ప్రొసీజర్ లైక్ సి, ఓకే? సో సెకండ్ గైస్, సో అయితే మనం ఎలా సింపుల్ గా కోడ్స్ లీడ్ చేయొచ్చు అనేది చూపిస్తాను నేను. వాయిస్ మ్యూట్ పెట్టుకోరా ప్లీజ్. Yeah, so the body part is duodenum, okay? So the option 1, okay? So no additional biopsy procedures, no additional biopsies, okay? So no more ECG procedures, no ultrasound guidance. See the 0 med and surgical section, the D, so the second character value D, gastrointestinal system, the third character root operation excision, the character value is B. So the fourth character body part, so that is duodenum, the character value is 9. So the approach is by default C, 8 approach is via natural or artificial opening endoscopic approach. See, the 8 is via natural or artificial opening endoscopic approach. ఎవరైనా డౌట్ అడుగుతున్నారా? Natural or artificial opening with percutaneous endoscopic approach, okay? So via natural or artificial opening with percutaneous endoscopic approach, in this approach only one procedure is performed. That procedure is laparoscopic assisted vaginal hysterectomy, ఓకే? సో ద వెజైనా, ఎప్పుడైనా వెజైనా నుంచి మనకి ఏదైనా ప్రొసీజర్ చేస్తే వెజైనా అనేది మనకి చేసేటప్పుడు ఆ వెజైనా దగ్గర ఏమి ఇన్సెషన్ చేసి కట్ చేసి బేబీని ఏం బయటికి తీయరు కదా,
Yes, sir.
okay? So that is via natural or artificial opening basically, okay? So via natural or artificial opening, general laparoscopy ante approach enti? What is the approach for laparoscopy?
Endoscopy.
Percutaneous endoscopy, okay? So the laparoscopy approach is percutaneous endoscopy, okay? అలా మనకి వెజైనా నుంచి హిస్టరెక్టమీ, ఓకే? అంటే వెజైనాలో స్కోప్ అనేది ఇన్సర్ట్ చేస్తున్నాడు, లాప్రోస్కోపీ అంటే ఆ వెజైనాలో ఇన్సర్ట్ చేస్తున్నాడు మనకి స్కోప్, ఓకే? సో ద లాప్రోస్కోపీ ఈస్ percutaneous endoscopy. Vagina means via natural or artificial opening, okay? So అలా via natural or artificial opening with percutaneous endoscopy, okay? So this is the best example, okay? వాడు క్వశ్చన్ ఎలా అడుగుతాడు అంటే గివ్ మీ ఎనీ ఎగ్జాంపుల్ ఫర్ వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ విత్ percutaneous endoscopic approach, ఆర్ సో దే ఆర్ ఆస్కింగ్ లైక్ లాప్రోస్కోపిక్ అసిస్టెడ్ టోటల్ వెజైనల్ హిస్టరెక్టమీ, వాట్ ఈస్ ద అప్రోచ్ అని క్వశ్చన్ అడుగుతాడు, ఓకే? ఇలా అయినా అడగొచ్చు, అలా అయినా క్వశ్చన్ అడగొచ్చు, ఓకే? సో దట్ ఈస్ వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ ఎండోస్కోపిక్ అప్రోచ్, ఓకే? అండర్స్టాండ్ గైస్? వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ విత్ percutaneous endoscopy.
Yes, sir.
ఆల్రెడీ ఆర్టిఫిషియల్ గా ఓపెన్ అవ్వాల్సిన ఎనటామికల్ రీజన్ లో ఒక స్కోప్ అనేది ఇన్సెట్ చేసి సో అక్కడ మనకి ఒక హోల్ చేసి పర్క్యూటానిస్ ఇన్సెషన్ చేసి లోపల లాప్రోస్కోపీ పాస్ చేస్తున్నాడు అంటే సో దట్ టైప్ ఆఫ్ అప్రోచ్ ఈస్ కన్సిడర్డ్ యాజ్ via natural or artificial opening with percutaneous endoscopic approach. Okay, so the final approach is external approach. Okay, so external approach ante manaki baita. Okay, so without incision manaki edaina procedure perform cheste so that is external approach like closure fracture reduction, laceration repairs, tonsillectomy. Okay, so this is also very important question, guys. Okay, they are asking like examples. Okay, so give me some examples for external approach. So that time the closure fracture reduction, laceration, skin biopsy, tonsillectomy, adenoidectomy. So these are all the examples for external approach. Okay, so అక్కడ మనకి ఇన్సెషన్ ఏం చేయకుండా ప్రొసీజర్ పర్ఫామ్ చేస్తే సో దట్ టైప్ ఆఫ్ అప్రోచ్ ఈస్ కన్సిడర్డ్ as external approach. Okay, so these are the 7 approaches. Okay, so these are all some examples for the images for the like skin laceration repair. What is the approach?
External approach.
External approach. Good. Okay. Yes. Okay, so code as open approach. So చూడండి అక్కడ లాప్రోస్కోపిక్ సిగ్మాయిడ్ రిసెక్షన్ అయితే ఇలా లాప్రోస్కోపిక్ పాస్ చేసి ఇలా సిగ్మాయిడ్ కోలాన్ ఎక్సిషన్ చేస్తారు. అదే ఓపెన్ అయితే సో కోలాన్ కట్ చేయడం ఎలా అనేది అప్రోచెస్ చూపిస్తున్నాడు. ఓకే, అదే ఇప్పుడు కిడ్నీ స్టోన్స్ లో మనకి ఒక ట్యూబ్ అనేది పాస్ చేసి ఆ ట్యూబ్ ద్వారా మనకి లోపల ఉన్న స్టోన్స్ ని బయటికి తీస్తున్నాడు. అంటే ఇప్పుడు ఈ అప్రోచ్ ఏమవుతుంది? పర్క్యూటానిస్ అప్రోచ్. ఓకే, ఏదైనా ట్యూబ్ కానీ కెథటర్ కానీ పాస్ చేసి దిస్ ఈజ్ లాప్రోస్కోపిక్ అసిస్టెడ్ వెజనల్ హిస్టెక్టమీ. వాట్ ఈస్ ద అప్రోచ్? ఇప్పుడే ఇది చాలా ఇంటర్వ్యూ ప్యాటర్న్ లో చాలా ఇంపార్టెంట్. ఇలా అయినా అడగచ్చు, అలా అయినా అడగచ్చు అని చెప్పాను. via natural or artificial opening with percutaneous endoscopic. Okay, so closure reduction. So this is external approach. ఓకే, జస్ట్ మనకి ఇక్కడ ఒక ఎక్స్టర్నల్ ఫోర్స్ అనేది అప్లై చేసి బ్రేకేజ్ అయిన బోన్ ని మళ్ళీ ఎగ్జాక్ట్ లొకేషన్ లోకి తీసుకొచ్చి సో ట్రీట్ చేస్తున్నాడు మనకి. సో దట్ ఈస్ కాల్డ్ ఎక్స్టర్నల్ అప్రోచ్. ఓకే, ద టాన్సిలెక్టమీ ఆల్సో మనకి ఇక్కడ కన్ఫ్యూజ్ ఏంటి అంటే మౌత్ ని ఇలా ఆర్టిఫిషియల్ గా ఓపెన్ చేస్తున్నారు కదా, సో దీన్ని వయా నేచురల్ ఆర్ ఆర్టిఫిషియల్ ఓపెనింగ్ అనుకుంటాం మనం. సో బట్ దట్ ఈస్ నాట్ కరెక్ట్. సో ద టాన్సిలెక్టమీ యూ కెన్ కన్సిడర్ యాజ్ ఎక్స్టర్నల్ అప్రోచ్ ఓన్లీ. ఓకే, డోంట్ కన్ఫ్యూజ్ దట్. ఓకే, సో దిస్ ఈస్ ఓపెన్ వర్సెస్ పర్క్యూటానిస్ అప్రోచ్. ఓకే, సో మనకి ఓపెన్ కోలిసిస్టెక్టమీ అయితే ఇలా చేస్తారు మనకి. ఓకే, ఆ అబ్డామిన్ ఇలా కట్ చేసి ఆ లోపల గాల్ బ్లడర్ ని రిమూవ్ చేస్తారు. అదే పర్క్యూటానిస్ అంటే జస్ట్ ఇలా నీడిల్ ని పాస్ చేసి ఆ లోపల ఉండే ఫ్లూయిడ్ ని రిమూవ్ చేయడం అనమాట. ఓకే, so that is parasynthesis procedure via natural or artificial opening like. Okay, so this is via natural or artificial opening. So this is via natural or artificial opening with endoscopy. So yes, tomorrow we will complete device and qualifier values. Just that is 5 to 10 minutes. Are very interested. Okay, so tomorrow definitions, guys. Okay, so I'm asking some questions like what is Icd-10 Pcs? What is the full form of Icd-10 Pcs? Okay, who are implemented in Icd-10 Pcs? Okay, next, what is the code structure for Icd-10 Pcs? So how many sections in PCS? And give me some examples. So how many body systems in PCS? Okay, so when to consider anatomical region general and when to consider anatomical region upper extremity and lower extremity, and so how many root operations in PCS coding? Give me some examples. Okay, wait. Next, body part. The next one is approach. Okay, how many approaches in PCS coding and what are the approaches? Give me some examples for open approach. Give me some examples for external approach. Give me some examples for percutaneous endoscopic approach. Otherwise, I will give some examples so you can tell the approach. Okay, so these are all the questions for tomorrow class. Be prepared, guys. I will ask these questions for tomorrow class. Yeah, guys. So first 1 week you can listen the classes. Okay, so you can comfortable and you can understand the class. Okay, so you can continue on next week. So once you payment done, so I will give the 3M logins and passwords. Okay, so for example, now today is Monday. Okay, so the next Monday you can clear the first term fee, guys. Okay, who are newly joined in this batch. Okay, you can clear first term fee on Monday, next Monday. After that only you can continue the classes. Okay. So who are not on that group, so please ping me in important points. Okay.